Hello, we're online.
Hello.
Hello everyone, and um, we are continue our conversation about human brain wellness, and all aspects related to the human brain health. And today we're talking to clinical psychologist and neuroscientist with very interesting background, very interesting combination of knowledge and experience. Dr. Kamran Fallahpour, thank you so much for being with us.
Oh, my pleasure. For having me.
I know that you have a lot of credentials, and your bio is really long and impressive. I know that you've been published scientific discoveries in multiple magazines, including Oxford Journal, including American Station, Psychiatry, and multiple others. Also, you've been featured in multiple radio shows, multiple magazines, even National Geographic, which is absolutely impressive. And the most impressive thing, of course, it's your work. And today I really would like to focus on the Brain Resource Center. I know that anyone who'd ever made search online or tried to find anything related to the brain health, I'm sure 100% one way or another, they saw the website. Let's discuss what actually made you to do it and what actual people can find there, what it was made for and what people can find there.
Okay, thank you. Great question. Yeah, so I started the Brain Resource Center over 2 decades ago. And really my vision and mission for it was what we call applied neuroscience. It's like to find latest state-of-the-art neuroscience research and technology that can be applied to patient care today. We often know that when something is discovered in neuroscience or in academia, it takes decades for it to find its way to actual patient care.
But, sometimes centuries.
Sometimes centuries, you're right. So my interest was from the beginning, okay, let's find out what neuroscience offers, what are the tools, let's bring them all under one roof where we can do this kind of work for people who want to improve their mood, they want to improve cognition, they're interested in mental health, brain health, longevity, and of course, peak performance. And that's exactly what we've done.
So if we were talking from perspective of the patients who are looking for the mental health, we know that neuroscience, especially in the last, let's say, 5 years, it was dramatic change. There are so many discoveries, so many interesting micro and big, not discoveries, but openings. We know so much more.
Mm-hmm.
And on the website, so when a person looking for something related to brain and related to neuroscience, it's very interesting. What is the best way to do it? Are they looking for specific devices? Are they looking for the specific help? Are they looking for a specific solution for a specific disorder? You mentioned several, right? Can we a little bit clarify for our listeners what it's for? What kind of in which situations, in which conditions that works the best?
Yes. So we focus on disorders that basically have roots in either self-regulation, mood regulation, meaning things like depression, anxiety, even bipolar disorder, basically one's ability to regulate mood and also regulate physiology from a mood and perception point of view, which leads to things like obviously happiness versus, let's say, depression, or anxiety versus being calm, and so on. So
Yes,
really regulating that. Yeah. So
for me,
that's one
it was.
aspect of it, right? Yeah, go ahead.
Yes, so we know that currently, like psychopharmacology, highly popular around everywhere, and doctors, for the most part, they prefer to use medication, right? So why neurofeedback? Why the like something different that medication can work sometimes better than medication? In which cases neurofeedback could be a better choice than any medication?
Yeah. So let me just kind of try to put an umbrella term there, neuromodulation techniques, because neurofeedback is a subcategory of that. We use actually a variety of what we call neuromodulation techniques that are basically procedures and techniques that are used to impact the physiology, the brain, and the nervous system, and to help regulate it and rewire, so to speak, the brain and the nervous system. So if you think about mood disorders, let's say anxiety or depression, obviously pharmaceuticals have been successful in addressing at least part of this population's problem with mood disorders, but medication has its own side effects, and it doesn't always work for everyone. There are many individuals who take medication, but it's not effective for them, or it is effective in the beginning and then it stops working. Many times people experience side effects that are very unpleasant. And also some of the medication, including, let's say, medications that are for anxiety, are habit forming and addictive. They also have often implications or side effects such as problems with cognition, like focus, attention, memory. People who take anti-anxiety medication, even sometimes antidepressants, it has a negative impact on cognition often. Also, as I mentioned, many people just don't respond to it well. For all those reasons, there needs to be interventions that either augment the impact of pharmaceutical approaches, or can actually help reduce reliance on those substances. And that's exactly what we do. And we have patients who come in who are taking medication, and we help them basically reduce reliance on it, or sometimes they completely go off of it, in fact, very often. And sometimes if they stay on it, they just function much better, because being on high doses of medication for a long time obviously has all kinds of side effects. And also what's important is to understand and be aware of the fact that pharmaceuticals don't teach the brain any new skills.
Yes.
But
And I would
brain
like,
training, yes.
and that's very interesting, exciting subject matter. So rewiring the brain, because you mentioned this that neurofeedback is actually allows to really almost physically rewire the brain. So the question is, how do you approach it? Like, I know that there are like multiple steps has to be done, right? So the question is, do you use specific medications again to like improve neuroplasticity or something? Do you use specific exercises? What kind of stages a person has to pass to basically transform the brain, to rewire the brain? Do you still do therapy with them? How do you?
These are
It's
all
interesting.
great questions. Yeah. So when we start within our model in our clinic, which has the assessment phase and then the treatment phase, the assessment phase is to determine how that person's brain is unique. It's almost what is their brain dynamics and their brain signature. And I think this time and age, we should all know our own brain dynamic. And the other part, aside from mood and self-regulation is about cognition. We should all also know what are our strengths and weaknesses when it comes to cognition.
Mm-hmm.
Things like attention, focus, memory, executive functions, emotional intelligence, etc., etc. So the first step in our treatment is the assessment phase, which is aside from the traditional intake, which is going through like what are the symptoms, history, and so
Evaluation.
on.
Mm-hmm.
We do two other types of tests. We do something called a brain map, which is quantitative EEG, which really is a way to look at not brain structure, but brain functions. And when we look at brain functions, it tells us the dynamics of the brain and various networks. Some of them may be overactive, some of them may be underactive. Sometimes two regions or networks in the brain, they don't talk to one another the way they should, or the opposite, or maybe there's too much connectivity. All of these have implications for our brain health, for our mood regulation, and for our cognition. So once we have that, we also do a bunch of tests that have to do with things like memory, attention, focus, impulse control, executive functions, along with a bunch of clinical scales that give us a baseline for the symptoms. Taking that information plus the patient's history, and of course their goals and aspirations, like what is it that they like to work on more, then we take that and then we bring in a variety of methodologies, including neurofeedback, TMS, TDCS. There are a few other interventions that are related. And also, sometimes, many times, there's a need for some psychotherapy, whether it's cognitive behavioral, insight oriented in some cases, and sometimes more like coaching. We do executive coaching, we do coaching with people who just have more goals in their life and how they want to focus on those things. So all of that kind of is under that umbrella.
I have a question. For me, it's always interesting because we have our brain, we have very unique brains, like every single of us. Very depends on experience, very a lot of things, genetics, life experience, a lot of diseases, even viral diseases, so many things. Anyhow, so when you see some significant changes from the normal in the brain, can it be just some personal, because we know some people just have some unique things going on in the brain. Because sometimes, sometimes we simply not enough data, like to simply understand. It's like some unique feature, or we have to like pay attention. It's like certain disease or inclination. For me, it's always interesting how long it takes to gather enough data to understand, like to have a better perspective what's going on, and how to not make a mistake. Sometimes, like when we even talk about depression, depression state. For some people, one way and another, like some people have inclination in the like thinking process. It doesn't mean that they are depressed. It's just the way how sometimes they cope within the environment. Sometimes it's a matter how they just the way they used to understand and perceive things. And for me, it's always interesting. What is the thin line between normality and something that has to be addressed clinically?
Yes, that's a very thoughtful question. And I'm going to try to answer it with addressing, few different angles or approaches to it. So number one, I do agree that every human being, the same way we have our fingerprint, our brain has a fingerprint. It has a very specific dynamic that's very unique to us. And that's one of the things that we like to test using quantitative EEG and neuropsychological assessment. So we do get that unique pattern that, let's say, your brain may have versus my brain versus some other person. But we do compare age and sex norms to each individual. In other words, if you came to my clinic and we did your brain assessment, we'll do a brain map using quantitative EEG, which is a form of EEG that gets into statistical analysis and also comparison to norm. But your data will be compared to a normative database around your age and for females, obviously. And that unique comparison tells us that, okay, this person versus this population around the same age, what are the ways that your brain dynamic is different? And there are particular patterns that have been identified through these databases and through studying the brain and the various networks that we know. For instance, most people with ADHD have what we call hypofrontality. Some aspects of the prefrontal lobe, some regions are not as active. Someone with depression or anxiety has a particular different signature in their brain. Someone with brain injury will have a different depending on the type of injury. Someone with stroke, and we see a lot of people with brain injury and stroke as well, and we see particular patterns that are unique to their particular disorder. Let's say if someone has a right side stroke and maybe they lose some motor capabilities on their left side of the body because they're contralateral, we also see the impact of that in their brain dynamics. Or someone with depression or anxiety or PTSD, for instance, they all have their own unique patterns that we can identify as we compare to norms. Now, obviously, people who are also in some ways deviant from the norm, but they also have strengths, for instance, they will test differently. Let's say someone who doesn't have a mood disorder and in fact their brain functions above the norm. Sometimes there are differences in their brain dynamics that we see, but again, they are different from the norm, but it doesn't always mean pathology, and one has to be mindful of that. And personally, as a clinician and as a neuroscientist, my interest is really understanding the uniqueness of that person's brain dynamics, their cognition, their personality, and kind of helping really to kind of drive them, to help them go towards their own personal peak performance rather than trying to fit them within a box of this should be normal.
You mentioned very interesting things. Database. I know that you probably already have a lot of cases, clinical cases, a lot of information developed. And for you, probably you already developed some sort of your personal database that you use in your clinic, right? So so the thing is, how is this information available? In terms of how easy is it in general? If person would like, it's going to be the last question, because we know we're really restricted in time. It's the last question, and we will continue conversation next time. Anyhow, so if a person would like to get a help, how easy is it? What is the best way to find specialists in the area? What is the best way to find the right clinic? And how to basically understand that you are dealing with professionals who really understand the brain and the subject matter from on the good level that actually will help them to provide for someone who are not in New York, and we're talking about people who are, because there are people, we have audience from all around the globe. So for us, it's very important to provide information how actually people can find help if they need. Yes. What is the best way?
I would say it's a very good question. It's not easy to determine even I would say even for clinicians, it's not always easy to know the reality of the level of expertise of other clinicians. For consumers, it's even 10 times harder. So it's very difficult. So to have the ability to really, determine who's an appropriate clinician or center for them is quite important. Part of it is personal choice. If you were doing psychotherapy, for instance, you would
Mhm.
obviously look for someone who offers that type of psychotherapy. For instance, there is, you know, psychodynamically oriented. There is CBT, there is DBT, there is, there's various styles, and then you find an
Mhm.
expert in that area. When it comes to this particular area, when there is a combination of psychological knowledge, neurological knowledge, technical knowledge of devices, procedures, databases, what equipment to use, and how to interpret, it gets very complicated. So I think consumers really, patients need to look for convergence of evidence. Let's say, to um, find a clinician who has adequate, obviously, education. They have had adequate training, like where were they trained? Let's say they have a PhD or MD from some university that's reputable, but then where were they trained? Who trained them? Then how many years of experience do they have as a clinician? But more specifically, how much experience do they have in this specific area? Because although the knowledge of the brain and EEG, quantitative EEG, and neuromodulation techniques has been around for decades, many clinicians come to it very recently, so they're not very experienced with it. They may be very good clinicians as a psychotherapist, but they may not have as much experience in terms of having the knowledge of the brain, neuroscience, neuroanatomy, understanding how neurotechnology works, the
Mhm.
different options for brain mapping, different options for doing the assessment, and then translating all that data into what is a good treatment plan that actually works. For instance, I have known of clinicians and even centers where they do a fabulous job of doing some form of, let's say, mapping of the brain. But what they can't do properly is translating that into proper treatment. So there has to be a cohesive experience and knowledge
Mhm.
that is from A to Z, from the assessment, from brain mapping to the understanding how to interpret that data and how to translate that into actual treatment plan that uses a combination of neurotechnology, devices, software, and all obviously also the training and the coaching that's involved in allowing that particular patient to really go through that, deal with their issues, and actually flourish and hopefully get into peak performance and beyond just getting rid of symptoms, but to become their best actualized self.
And there is no developed network with like reviews with a specific like ratings. There's no such thing yet.
Yeah, yes. There are many ways that these days online people have ratings and all that, and those are some indicators. They're always useful, but I would say that's not the only thing one should be looking at. One should really do further research
Mhm.
and really look into the breadth and depth of one's experience in multiple disciplines that really makes this kind of work
Mhm.
really be efficient, because it's not just one discipline. It's a convergence of few different disciplines that come together in this way.
Amazing, very interesting. Okay, let's finish for now, and we will continue conversation. Thank you so much for
It's
today.
been a pleasure. Thank you. Thank you. Good talking to you.
This is why you need 3H Brain in your life. It's time to revolutionize your health. 3H Brain is your ultimate guide to understanding the human brain and heart. Explore the deep connection between psychological, neurological disorders and chronic conditions. With 3H Brain, you'll discover a treasure trove of helpful information, resources, and support to help you thrive. Dive into courses that offer fresh, modern perspectives. Take tests that bring you closer to innovative solutions designed to cure and strengthen your brain and heart. 3H Brain isn't just a platform, it's a movement towards better health. Join a community that's striving for excellence and knowledge. Get inspired, stay informed, and take control of your health journey like never before. Ready for a smarter, healthier you? Discover 3H Brain today, because your brain and heart deserve the best.